Coffee, tea, chocolate. What do all these things have in common and how do they affect sport performance? There is controversy surrounding caffeine and its effects on exercise. However, further research needs to be done on how it pertains to sport performance. The reasons for the controversy are how caffeine affects the body physiologically, how it affects substrate use, and whether or not caffeine should be a banned substance. So before we talk about caffeine, we should talk about adenosine first, because adenosine has the opposing effect that caffeine does on the body. Adenosine receptor sites can be found in the liver, in the adipose tissue, in vascular endometrium, and in the muscle. We're mainly going to be focusing on the muscle today because that's where A1 adenosine receptors are found, which is the receptor that caffeine affects the most. So what adenosine does in the body is it slows down the heart rate, it contributes a lot to our sleep mechanism, and it slows down our sympathetic nervous system. So caffeine, when it binds to the receptor site instead of adenosine, caffeine has the same effect as a psychostimulant. So it has the same effect as cocaine or an amphetamine. It heightens our awareness of our surroundings, it heightens our sympathetic nervous system, and it increases our heart rate, which when taken in, and if this is the mechanism that causes caffeine to have this effect, it can improve our sport performance. This study was done by Sergio Ferreira, and he said that if this is the case, then when caffeine is consumed before sport performance, then sport performance should increase. The other mechanism that caffeine can affect is substrate use, or the theory is that it should be able to affect substrate use. So Graham and colleagues tested the effects of caffeine on fat and carbohydrate metabolism in a smaller version of a meta-analysis where they took data sets from different studies and combined them with their previous study and tested the effects. Well, the data concluded that a large amount of CAMP, which is cyclic adenosine monophosphate, was increased during exercise, whereas glycogen, citrate, and acetyl-CoA were not. This supports the mechanism that caffeine is an adenosine receptor antagonist rather than affecting fat metabolism and carbohydrate intake. So Graham also did a study an analysis on data from RER VO2 max and intramuscular triglyceride levels. And this study showed that caffeine did not affect any of those either. They also did another study with isotopes and found that there was no change in carbohydrate metabolism as well. Although these studies have not concluded whether caffeine can inhibit enzyme activity, enough evidence suggests that there should be more research on this subject. So the main question is, should caffeine be a banned substance or is it okay? The main reason that people think it shouldn't, or researchers think that it shouldn't be on the list, is because nobody can prove whether or not athletes are using this as an actual doping substance or whether they just like caffeine. So in a study done by Juan Caso, the urine samples that they tested did not prove and were not statistically significant enough for them to be concerned that people were actually using this as a doping mechanism. While some studies concluded that glycogen sparing increased fat metabolism and carbohydrate use, there were so many discrepancies in the research that we couldn't validate the research. So there were small sample sizes, the testing was analyzed wrong, things of that nature. So a lot of the research points more towards caffeine being an adenosine receptor antagonist more than it does having an effect on fat metabolism or carbohydrate use. So instead of worrying about caffeine intake, keep enjoying that morning cup of joe.